presentation is going to tell about in 2014 published article, which was a part of my doctoral thesis. And I would like to thank my supervisors and professors Seppo Pyrhönen and Helena Leinokilpi. I'm from the Turku University Hospital Cancer Center, from the yellow area of the south district of southwest Finland, where breast cancer is the most common cancer type among 800,000 citizens. The content will present the background and development and testing the electronic patient dedication intervention for breast cancer patients. This study is part of our Empowering Patient Education research program. Patient education and counseling are essential in nursing care. The ultimate goal of patient education is to support the patient to be empowered in their life and health-related problems of care with empowering knowledge according patient's own knowledge expectation. Purpose of our program is to develop new methods for patient education and to evaluate the outcomes of educational activities. We constructed a theory that education based on 6 dimensions of empowering knowledge, biophysiological, for example, illness, symptoms, treatment and complication, functional, including mobility, rest and nutrition, experiential, ethical, social and financial dimensions. Patient education is important in the radiotherapy context as well. According to our earlier study, there were multi-dimensional knowledge expectations among cancer patients in radiotherapy, mostly about biophysiological and functional subjects. We defined feedback as an information about the result of performance, and this is often about a consultation or skill that has been performed by learners and observed by teacher. Feedback is given often informally by face-to-face, but also formally after response knowledge test. Feedback generated through internet is called e-feedback. E-feedback is defined as a message electronically generated response to a learner's action. The advantages to receive e-feedback through internet are as the ability to provide immediate, unbiased, accurate, non-judgmental knowledge. And in addition, feedback is irrespective of learners' characteristics and nature of the response. In patient education, the e-feedback after response to the knowledge test is seen as a facilitator to support patients to know and improve their own knowledge level, to support empowerment and to support patient-centered care. According to earliest reviews, e-feedback is used in different approaches. As using computer for office-based patient education, using interactive computer-based patient education programs, using multi-dimensional approaches of different programs. It is used in interventions where questions and answers were provided and completed within or after lessons in hospital. However, outcomes were positive. Patients have better knowledge gain, dietary behavior, motivation, and so on. The intervention where e-feedbacks is followed after self-monitoring based on uploaded individual data through medical record or medical reminders or tips for overcoming self-care, outcomes were also positive. Patients had higher self-care, self-efficacy, and number of exercises. Then about our intervention. The e-Reno was intended to base on the content of breast cancer patients' knowledge expectations and to implement with EP feedback approach. It contained RT knowledge test and feedback. Finally, the e-Reno consisted knowledge of radiotherapy for breast cancer patients to support empowerment. We developed it in two parts. First, the RT knowledge test development, and then the e-feedback knowledge development for each item of the knowledge test. The structure was guided the literature of e-feedback approach, and we decided to use that elaborated feedback after responding to the knowledge test, explaining the correct answer and providing relevant knowledge to inspire learners and understanding. The literature of knowledge test development was also used. Then about the testing. We used a randomized controlled trial, and breast cancer patients in the RT were included. Outcome measured before first RT session and 3 months after final RT session, with the RT knowledge tests were cognitive. Hypothesis was that patients who received the e-Reno intervention before RT period will have higher knowledge level than patients in the control group receiving a standard patient education. The content, the e-Reno consisted 28 statements of physiological knowledge of RT process and possible side effects, and functional knowledge of side effects and self-care and lifestyle, daily life and RT. And then what patients were doing, they were first opening the link delivered via email, and then they were responding to the knowledge test, and after that they were receiving knowledge feedback knowledge after response. And then, does it work? Change of total knowledge level was significantly higher during follow-up in the intervention than in the control group after baseline adjustment. Especially knowledge level of side effects self-care was significantly increased. There were significant associations of patient characteristics with knowledge level at baseline and in the change of knowledge level. However, none of the interactions between patient characteristics and group on change of knowledge level were significant. And here we can see that the level improved in both groups, but it was significant in the difference was significant, and the increase was higher in the intervention group. And here we can see that the significant p-value of the side was in the side effect self-care category. And then about associations of patient characteristics and knowledge level. University or secondary level education versus no education, employed versus retired, patients having higher computer literacy, and younger patients were associated with baseline knowledge level significantly. they had a higher knowledge level before RT period. Then patients having higher computer literacy and younger patients were significantly associated with change of knowledge level. They had higher increase in knowledge level. And as conclusion, the e-feedback after response to the knowledge test used alone as a patient education approach was missing. And the e-Reno was effective especially to improve knowledge of side effects self-care. In line with journals all over the world using narrative by electronics test, in addition to traditional written story, would be exploited for patient e-education as well. New solution as using voice, picture and interactivity should be developed, and further testing is needed among other cancer patient groups. Thank you.
Thank you very much, Dr. Mervi.